My name is Ute Sendler. I am an internist, a hematologist-oncologist, and a cardiologist. A patient in Germany is treated like a king. Over the past 5 years, oncology has experienced a real revolution. Now doctors have in their arsenal molecular therapy, antibody therapy, and such an innovative method as immune checkpoint inhibitor therapy. Indeed, we now have great opportunities at our disposal. There are currently many methods for treating hematologic diseases, and we can even talk about the complete cure of diseases, which until recently we could only have dreamed of. The decisive factor in oncology is the discussion of the upcoming course of treatment, and therefore the qualified work of the interpreter and communication with the patient are of great importance. There are always some treatment options, even for chronic diseases. When a patient is a candidate for palliative care, the patient becomes hopeless only when they give up. Therefore, it is a disease that is worth fighting. For example, the patient may receive a second opinion. A treatment regimen may be elaborated for them, or they may purchase drugs in Germany and continue treatment in their native country.
Good afternoon, Dr. Sendler. Thank you very much for agreeing to the interview. We are very happy to meet you. Could you please introduce yourself?
My name is Ute Sendler. I am an internist, a hematologist-oncologist, and a cardiologist. I have been working in Munich for 15 years now. I graduated from the Technical University of Munich, after which I had my clinical training in 3 areas of my specialization, and now I'm looking forward to our interview.
Could you please tell us how many foreign patients come to you annually?
Until 2019, about 200 to 250 foreign patients came to us for diagnostics and treatment annually. Due to the global coronavirus pandemic, it was more difficult for foreign patients to come for treatment, so their number has slightly decreased. Due to the hostilities in Ukraine, it is also not easy to admit foreign patients today, but I still think that the situation with the admission of patients from abroad has improved a bit.
From what countries do patients come to you for treatment?
The geography of patients depends on the medical field they are interested in. We treat Russian-speaking patients from Russia, Ukraine, and Kazakhstan. Many of our patients come from Armenia, while a smaller number of our foreign patients are from Arab countries.
Why do patients go abroad and invest large sums of money when they can receive free medical services in their native country?
From what I hear from my patients, European countries and Germany in particular are considered high-tech. Many innovations are available here. A large number of scientific projects are being implemented and high-quality medical care is provided. A certain role is also played by the quality of medicines, which varies from country to country.
Dr. Sendler, why do you think patients come to Germany, and what are the advantages of Germany in comparison with other European countries?
I asked my patients why they chose treatment in Germany. Their answer to this question is that the patient is treated like a king in Germany. The relationship between the doctor and the patient is cordial, and there is practically no bureaucracy. Patients also noted the well-coordinated work of doctors during medical boards. Germany offers high-quality drugs, but these are quite expensive. When compared with the prices of medicines in other European countries, their cost in Germany is one of the highest. In addition, there are some bureaucratic issues and control of all processes in Germany, thanks to which the patient is guaranteed the highest safety of medical care. The popularity of Germany among patients can also be explained by the fact that the country is located in the very heart of Europe and attracts with its sights. In particular, Munich is also a popular tourist destination, so the city receives many visitors from abroad, including medical tourists.
In your opinion, are there any differences in the treatment of cancer patients in Germany and other countries?
I believe that some differences do exist. For example, if you look at medicine in the UK or even in the US, it is very difficult for patients to get advanced medical care, or the cost of healthcare services is so high that a mere mortal cannot afford them. The range of medical services in other countries is also not as extensive as in Germany. I think that complaints that our healthcare system needs major modernization are groundless. I guess that we offer top-class medical care, and at the same time the widest range of services is available in Germany. In addition, every person here has access to advanced medicine, regardless of whether they have insurance or pay for treatment on their own.
With which oncological diseases do foreign patients mostly seek medical help from you?
Our clinic treats all oncological diseases, and the most common are those cancers that we are most frequently faced with in Germany. These are breast cancer, lung cancer, prostate cancer, and colorectal cancer. These types of cancer are the most common in Germany. We also often deal with the treatment of hematologic diseases, lymphomas and leukemias. Acute leukemia cases are extremely rare because the disease is severe and it is difficult for patients from abroad to tolerate the flight.
What's new in the treatment of cancer in recent years, and what innovative methods have been developed?
I should say that I am happy that I am also making my contribution to the development of oncology. Over the past 5 years, oncology has experienced a real revolution. Over the past decade, biological therapies and immunotherapy have entered clinical practice. While before that the only universal method of fighting cancer was chemotherapy, which caused many side effects, doctors are now using a more personalized approach to treatment. Now they have in their arsenal molecular therapy, antibody therapy, and such an innovative method as immune checkpoint inhibitor therapy. Immune checkpoint inhibitors are medicines whose action is aimed at activating the forces of the patient's body to fight cancer. For example, these can be used for melanoma, which was previously considered a death sentence and an incurable disease, or a number of chronic diseases. So progress in the field of oncology is evident. There have always been many so-called open questions in the field of cancer treatment, and previously we could only offer chemotherapy to patients, but at the moment we really have great opportunities in this area of medicine.
What do you think we should expect from medicine in the next 5 to 10 years? Will doctors find a way to completely cure cancer at any stage, maybe even without surgery?
Thanks to the development of new treatments in oncology, diseases from which people used to die within 2 to 5 years can now be made chronic with the help of immunotherapy. Molecular diagnostic methods for leukemia and lymphomas have been improved as well, so we can now see many innovations. In my opinion, oncology is a very interesting medical field. There are currently many methods for treating hematologic diseases, and we can even talk about the complete cure of diseases, which until recently we could only have dreamed of.
What should a patient who decides to go for treatment at a foreign hospital pay attention to?
It is important that patients send all their medical reports in advance. The translation of these medical reports must be of high quality. Whenever possible, the patient should also send the results of diagnostic imaging. In complex cases, it is desirable to provide paraffin blocks with tissues obtained during a biopsy, which will allow for a more detailed picture of the patient's condition. The patient should then start organizing their trip to Germany. The patient needs a valid passport and a valid visa, and they also need to take care of booking a hotel or an apartment to stay in during their trip to a foreign country. On the part of the clinic, it is necessary to make preliminary cost estimates so that the cost of treatment abroad does not become an unpleasant surprise for the patient. Although this is often quite challenging, sometimes I am provided with too little data on the basis of which it would be possible to calculate the approximate cost of treatment. For example, today, I was given only one scan, but this of course is not enough to elaborate a treatment regimen and make preliminary cost estimates, so this approach may fail in some situations.
What documents and diagnostic results need to be provided in advance?
Patients have to provide in advance the results of their X-rays and the results of a histological examination if possible. The results of these examinations are of crucial importance.
Do patients have to undergo repeated diagnostic procedures before starting their treatment?
As a rule, it depends on the comprehensiveness of the diagnostic results provided by the patient. In some cases, we can perform additional examinations, but if the patient has a CDR with a record of their diagnostic imaging results, or they provide us with a link with access to their diagnostic results, it is possible that the patient will not need any repeated diagnostic procedures before starting treatment.
Are there any cases where examinations reveal that the patient has a completely different diagnosis or stage of the disease?
Yes, there are such cases. I had the impression that especially in Russian-speaking countries, patients are often mistakenly diagnosed with non-existent diseases. Patients from these countries always come with almost 15 diagnoses, but usually my most negative expectations regarding the patient's condition are not met. About 8 to 10 years ago, I had one patient, a physicist. At the moment of his arrival at our clinic for treatment, he was diagnosed with a disease that was essentially a death sentence, but in fact it turned out that he had just superficial skin lesions, and there was absolutely nothing complicated in their treatment. So I can say that I had incredible stories in my clinical practice.
What are the diagnoses for which foreign patients most often seek medical help from you?
Foreign patients with breast cancer, lung cancer, colorectal cancer and lymphomas, which are cancers of the lymphatic system, most often seek medical help from us. Our service range includes providing medical care to patients with all types of cancer, up to stem cell transplants.
What are the main problems in the treatment of cancer patients? How do you manage to solve these problems?
In answer to this question, I have to say that the decisive factor in oncology is the discussion of the upcoming course of treatment, and such serious things as health must be spoken about with compassion so as not to hurt the patient because they will have to live with this. Therefore, the work of an interpreter and communication with the patient play an important role. My experience and knowledge now allow me to understand, although not quite exactly, what of what I have said is actually translated for the patient. Of course, it is beyond my powers to tell the patient about their health condition and absolutely not cause them unrest about it, but a high-quality translation is also of crucial importance in this case. Another difficulty in the treatment of cancer patients is related to the fact that the therapy is carried out in cycles. The patient comes for a course of therapy, for example, every 3 weeks, so the flight itself can be quite exhausting if the patient's native country is far from Germany or another country where treatment is planned. For example, if the patient needs to come to the clinic for an infusion therapy that lasts approximately 6 hours, it is very difficult to arrange arrival and departure times on the same day. Things are quite different when the patient is a candidate for surgery because a diagnosis is made, so the patient is operated on and the therapy is thus over. In the case of infusion therapy, the duration of treatment is at least 3 to 6 months. In this regard, the process of treatment used to be easier.
What, in your opinion, determines the effectiveness of treatment?
In oncology, as in psychology, the effectiveness of treatment depends on the interaction between a doctor and a patient. The effectiveness of treatment depends on the professional qualifications of the medical staff, who should also show empathy towards patients, a pleasant atmosphere and a cozy environment in the clinic. And of course, the correct choice of drugs plays the most important role.
What advice would you give to patients who have been fighting cancer for a long time and are already desperate to get any results?
I would recommend getting a second opinion. There are always some treatment options, even for chronic diseases. When a patient is a candidate for palliative care, the patient becomes hopeless only when they give up. Therefore, it is a disease that is worth fighting.
For which oncological diseases do you recommend patients undergo treatment in Germany?
Treatment in Germany is suitable for all cancer patients who require outpatient treatment with modern medicines. We have to admit that many countries do not have access to new medicines. The reasons for this are unknown, but the fact remains. Thus, the patient can receive any kind of outpatient treatment in Germany.
What advice would you give to patients who are now at the decision-making stage about whether they should undergo their treatment in Germany or stay in their native country for treatment?
Of course, there are situations where it is better for a person to stay at home with their family. However, the patient always has the opportunity, for example, to obtain a second opinion in advance, plan and organize treatment in Germany, or purchase medicines in Germany and continue treatment in their native country. This is quite a common practice. We answer questions by email and conduct online consultations via Zoom for patients who are undergoing treatment in their native countries.
Dr. Sendler, thank you very much for the informative interview. I wish you all the best.
Thank you.